Now we are going to use the Sawyer Farm CBD Pain Salve, which is 500 milligrams and has lemongrass. It's mixed with beeswax, which is a stable medium and also good for deeper tissue work. You can glide, but there's a little tackiness to it so you don't slip, and it's more concentrated. So you really only need to use a very, very small amount. So no more than this for like an area that you have a knot or an adhesion. That's a great amount to use. And I'm using just a little bit of, I guess you could say a little traction. So I'm leaning back into it and pulling just a bit on occiput to sort of open that area up, see if I can stretch it slightly before I try to break up the tissue, which I think is a little bit more of a gentle approach than just going in. And I'm just following scalenes and anterior neck muscles back up to the occiput. It's always nice to come all the way around to the side and pull up. And let's never forget ears and here, right at the end of the occiput bone, where a lot of attachments to these smaller neck muscles come in. Definitely give that some attention and make sure it gets some of that CBD. So now that I have him in this position where his head is rotated, I can really feel, okay, this is an area that's where it really starts. You always want to be aware of the line. We never go towards where you see Adam's apple. This is right here is as far as we're going to go on the neck. This is an endangerment site. You never put pressure there. Okay, so as I'm going through the layers, I'm getting deeper and I can feel right in where he felt the knot, and I'm just going to hold that. So we always want to make sure we're using good body alignment and using the weight of our body to give the pressure. Your hand should always stay loose. Pressure shouldn't be coming from your fingertips or you're going to have a very, very short career. There we go. Okay, good. So just to keep things even, we're going to do a little on both sides. Check back in at occiput. Use a good traction. And while I'm here, I like to check for alignment in terms of once I put the head back into neutral position, where does it fall on its own? So that looks pretty good. If I'm looking straight down, the chin is not rotating either way in one direction. Sometimes you can have it all different kinds of things, but that doesn't seem to be the case in this. So the next thing is we're going to turn him over. You can also address the neck in this position. I wouldn't suggest it when you're talking about extensive work in the occiput, because inevitably it starts to feel like you're pushing the person's head into the face rest, which does not feel good. And I'm just sort of looking to see what, as I'm going through muscle and fascia, what's changing and what's moving. So we're gonna let that sit as we can go through the layers of tissue, skin, tissue, and hopefully start to take some of that inflammation out. So it's always important to find out what are the positions that your client or patient is mostly in during the day. And so anyone that spends extended periods driving, you're definitely going to notice probably some hip and upper back stuff, because just like when you're working on the computer all day, you tend to get closer and closer to the computer. The same thing happens when you're driving, and you might not realize it, but the head starts to go forward, more and more forward. And what that causes is a lot of tension in the neck. So I'm going back and checking that area that we both felt was tight. And in this position, it's either fallen out of the way because of the way that the tissue is lying in this position, in the prone position, or it's starting to sort of work its way out. So that's good, but you want to definitely check it. Okay, so for lower back, Couple considerations. The main one is you don't ever put any pressure on where you know the kidneys are. So the kidneys are going to be about right here. So once you feel the last rib, 12, you can really feel, then you can go about this, like this, and know you're not putting any deep pressure on the kidneys. But you can around the sacrum, and you can all the way through the pelvis, right along where you feel the bone, making sure not to come across where the kidneys are. Good. So I'm gonna let that sit for a couple minutes, absorb, go through the layers. I wanna make sure around the entire scapula that these muscles are as loose as possible. Okay, let's recheck. One way you can check is coming underneath. And if I can just gently press up on this aspect and I can get that kind of movement, that's a good indicator that we don't have a scapula that's stuck or a frozen area. If I came in and I'm jostling and all I might see is a little of that, I would probably need to do a little bit more work. Remember, we're always keeping in mind that when inflammation is an issue, you don't want to overwork an area. So we've let the pain salve set in the along the sacrum. So I'm going to come in and do some deeper compressions with full hand compressions, and then move into soft fist. We can do deeper work, but we always want to combine it with some circulatory strokes, just because inflammation, we're trying to get rid of it. We want to have it release out of the cells or muscles, and then we want to flush it through the entire system. So as I'm doing, we don't generally like to press on bones, but you can just kind of check in which position the sacrum is in. Sometimes the sacrum, as it lies, and then your tailbone tucks this way, sometimes you can get a rotation to one direction, or goes this way. So that's important to know when you're dealing with any sort of rotation or chronic lower back issues. Repeat on the other side, check the neck, and probably do one more application, a little bit of the pain salve directly on those specific areas. I would instruct my client to use cold compresses, 15 minutes on, 15 minutes off, for the next couple hours after the session, to make sure that the work that we just did continues on. And that is how you use a topical pain salve with CBD. I hope that helped you guys at home, whether you're a massage therapist or just someone that likes to do massage at home for your loved ones. We'll be doing more massage, how to use topicals, how to use THC infused topicals in the very near future. So thanks so much for watching. If you have any questions, you can contact us through mbaholistics.com or find us on Instagram at Jessie Love Network and on Facebook at MBA Holistics. Stay tuned for the next massage videos and how to use THC infused topicals in the very near future. Thanks so much.